Hello everyone, this is Brainless Medico and I am Dr. Manoj, and today we are going to learn one more chapter under medicine, iron deficiency anemia. So let's dig into it. What is iron deficiency anemia? It's a microcytic hypochromic anemia caused by depletion of iron stores results into reduced hemoglobin synthesis. So epidemiology, most common worldwide, it is anemia. Then commonly seen in women of reproductive age, pregnant women, infants and adolescents, then elderly. Etiology will classify it under five types. So first one is reduced iron intake. So main cause will be poor dietary intake, malnutrition, or they may be vegetarian diet. And don't forget to tell me which is the highest iron stored dietary content we can take. Okay. Then decreased iron absorption, celiac disease, tropical sprue, post gastrectomy, chronic diarrhea, or chlorhydria. Then coming to third one, it may be due to increased iron requirement. It can be physiologically we see in pregnancy, lactation. So in PSM, your people will be studying how many extra calories they are going to require in pregnancy, and even what you say, iron and folic acid. Then adolescence, then rapid growth. Then coming to chronic blood loss, GI bleeding, peptic ulcer disease, malignancy, hookworm infestation, and menorrhagia. Pathogenesis, I explained very detailedly iron metabolism. I pinged that video in the above section. You can watch it if you want in detail. If you don't want more detail about pathogenesis, these 5 points are sufficient. Depletion of iron stores, which leads to reduced serum ferritin, which leads to decreased hemoglobin synthesis, and finally it causes microcytic hypochromic anemia, which is a clinical significance of this iron deficiency anemia. At last which leads to tissue hypoxia. Then general symptoms, it is fatigue, weakness, dyspnea on exertion, palpitations, and dizziness. And when it comes to iron deficiency anemia, specific features are pica, glossitis, angular cheilitis, koilonychia, hair loss. Then we see pallor, tachycardia, brittle nails, atrophic glossitis. Try to keep them in symptoms and signs separately so that you won't get confused or merged with them. Then coming to investigations, in first we will go with the, if anything there is problem with the blood means we have to go with the blood count, right? So hemoglobin, obviously it will be reduced, MCV will be reduced, MCH will be reduced, MCHC will be reduced, and RDW will be what? This is exception, right? RDW, it increases, and there is one more condition where everything increases and RDW will be reducing. Use the comment section, I'll be checking. Then coming to blood, peripheral blood smear, typically you are going to see these are your pencil shaped RBC, and these are your hypochromic. First you need to identify lymphocyte and you have to take them as a reference to RBCs, whether they increased in size or decreased in size. And these are your anisocytosis. Anisocytosis, tell me in the comment section whether it is variation in the size or shape. Okay, so what you are going to see here is microcytic hypochromic anemia. Microcytic, obviously size will be reduced. Hypochromic, hemoglobin content will be reduced. Anisocytosis, I asked the question, you can use the comment section to answer me. And poikilocytosis, which is shape variation. And I guess if you're smart, you could have already guessed the answer. After knowing poikilocytosis, it's a shape, then what is left? Yeah, that is anisocytosis. Then coming to iron studies, serum ferritin reduces, serum iron reduces, total iron binding capacity increases, and transferrin saturation decreases. Then bone marrow examination, absence of iron stores on Prussian blue will be seen. Okay, then differential diagnosis, you need to know the two main causes which acts parallelly with the IDA. So let's see them. Iron deficiency anemia versus thalassemia. IDA, thalassemia, MCV will be low here and increased RDW. Ferritin will be low, then RBC count will be low. Okay, then MCV will be very low in MCV, RDW will be normal, ferritin will be normal. These two are the important point you need to remember. RBC count may be normal or high, because yeah, that is important point. You can use the comment section. I'll be waiting. If no one answers, I'll be giving the answer. No worries. And iron deficiency anemia and what you say, anemia of chronic disease. Ferritin will be low here, but here normal or high. TIBC will be high, here low. Then serum iron will be low here, and here also it will be low. So important point, how you are going to manage if a patients come with a iron deficiency anemia. Treatment, first you need to identify and correct the source of cause of blood loss. Deworming if required. Yeah, it is most commonly seen in India. Parasitic infections causes iron deficiency anemia, which leads to like malabsorption. So you have to treat if any parasitic infection is there by deworming it. Then oral iron therapy, ferrous sulfate or ferrous fumarate, give on empty stomach, continue 3 months after hemoglobin normalization also. And parenteral iron, when we give it, is like indications mainly oral intolerance, malabsorption or severe anemia requiring rapid correction. If you don't have the time and you want the severe anemia to be corrected immediately, then you are going to give parenteral iron. Then if these two are not working and you want immediate, there is some emergency or something and you want immediate correction, you are going to give blood transfusion. Okay. And response to treatment will be seen. Reticulocytosis within 7 to 10 days will be seen. Hemoglobin rises 1 to 2 gram per deciliter per week. And complications, developmental delay in children, poor pregnancy outcomes. Yeah, if there is no hemoglobin, it affects the normal metabolism, right? Then reduced physical capacity. Obviously, oxygen saturation will be reducing and goes on. So prevention, iron rich diet and iron supplementation in pregnancy, deworming programs. And examples, most common cause of iron deficiency anemia, microcytic anemia. Ferritin is the best indicator. Treat the cause before giving iron. Continue iron after hemoglobin correction. And coming to summary, you have to read with me so that nothing will be missed out here. Yeah, it is too big. Yeah. Iron deficiency anemia is a common and preventable condition caused by depletion of iron stores. Diagnosis is confirmed by iron studies and treatment includes iron supplement along with the correction of underlying cause. Yeah, that's all. I hope it was easy and important topic. Even in pathology and medicine, you can't miss out. And if any part is not understood well, you can go what you say, you can rewind it and you can watch. And again I'm saying, if you want to learn more about iron metabolism, there is a separate video you can go and watch. Thank you.